Open sores anywhere on the body can be unpleasant, but when one shows up on the inside of your mouth, a sip of sweet orange juice will surely lead to a sour face, especially when you're a kid and you get canker sores all the time. From Delray Beach, here's medical correspondent Dr. Jackie Morocco.
Being a kid in the 21st century is hard enough, but when you compound the challenges of growing up with the pain of a canker sore, well, today just isn't getting any better.
When I get them, they sometimes itch and I want to bite them, but whenever I bite them, they hurt more.
I know.
Do you have one now?
I think.
Go, Jeff!
Canker sores are tiny ulcers inside the mouth. They are found on the tongue, the soft palate, and inside the cheeks. They are round, white-gray in appearance, and have a red edge.
How I get it is when I'm sucking on a lollipop or candy or anything sharp in my mouth, and it cuts the side of my mouth, and it'll swell and turn into this big puffy type of, it swells the skin, and it'll just really burn and hurt. It'll throb a little bit. And then there's the medicine, and you really don't want to get a canker sore. The medicine really doesn't taste that great either. But if you want to get rid of the pain, you gotta suffer a little bit of tasting. But it goes away, and you'll just feel better after a while.
There are two types of canker sores, but these children, 5th graders at St. Vincent's School, are most likely to get the type called simple canker sores. They are not contagious. For reasons we don't fully understand, they just begin to appear about age 10. And once the ulcer forms in the mouth for the first time, the child is likely to be in pain for about 4 days. It will seem to them, to these children, that they get canker sores all the time, and they won't be completely wrong. Because once canker sores start, most children get them 3 to 4 times a year.
I get them whenever I have a cold, and they hurt, and they're they really hurt inside. Your tongue hits them a lot. Bubbly.
By age 20, they will appear less frequently, and during adulthood, many people will stop getting them altogether.
What causes canker sores is still somewhat of a mystery, but we think what happens is the immune system does not recognize certain molecules, sending out white blood cells to attack these molecules, causing ulcers that we call canker sores.
Children can trigger their own canker sores with tissue injuries such as self-biting or by vigorous toothbrushing. Sometimes a dental procedure can bring them on, sometimes they may be caused by stress. This type of canker sore may look the same, but it's a bit different from the ones described earlier. They are called complex canker sores. They are less common but much more of a problem for their victims. A person with this type of canker sore has them every other week. That's because of a faulty immune system, a gastrointestinal tract disease, or a nutritional deficiency of vitamin B12, folic acid, or iron. Because there are no cures for canker sores, all any child can do is avoid foods that cause pain. Nuts are especially bad, and so are acidic foods like tomato sauces and orange juice. All parents can do is to select a toothpaste that does not contain sodium lauryl sulfate, a foaming agent found in many mouthwashes and toothpastes. SLS, as it is called, has a drying effect on oral tissue, and doctors believe this leaves the mouth vulnerable to acidic foods. And since injuries to the mouth do sometimes trigger canker sores, you could always remind your kids not to chew and talk at the same time. When you have canker sores, you can apply ice to relieve the pain, brush with a very soft toothbrush, use mouthwashes without SLS like Listerine, or even swish a little milk of magnesia over the offending area. There are also some over-the-counter medications that can be used to coat the ulcer and prevent it from hurting more than necessary. But if you have canker sores for more than 3 weeks, or you have a high fever, or you cannot control the pain, you should see a doctor for prescription medications. These, by the way, are not canker sores. They are cold sores and are often confused with canker sores. Cold sores are highly contagious and are usually spread through kissing. They are small, fluid-filled blisters that create raised, painful areas around the mouth, but not usually in the mouth where canker sores are found. In Delray Beach, this is Dr. Jackie Morocco for Health Check Second Opinion.